What is vaginal atrophy in menopause? Imagine feeling dry, uncomfortable, or even painful during activities that used to be easy and enjoyable. That's often what women experience with vaginal atrophy during menopause. Vaginal atrophy, also called atrophic vaginitis, happens when the walls of the vagina become thinner, drier, less elastic, and sometimes inflamed. This occurs because estrogen levels drop sharply during menopause, usually by about 85%. Estrogen is what keeps vaginal tissues healthy, thick, and lubricated. When estrogen decreases, the tissues become more fragile and less lubricated, leading to discomfort. This condition is a big part of what's called genitourinary syndrome of menopause. That term covers symptoms in both the vagina and urinary system. Women with vaginal atrophy might notice dryness, burning, itching, or pain during sex. Some may see light bleeding after intimacy or feel discomfort when inserting tampons. Urinary symptoms are common too. Women might feel a frequent urge to urinate, experience burning when urinating, or have leakage. Recurrent urinary tract infections are also linked to vaginal atrophy because the thinning tissues can make the urinary tract more vulnerable. Vaginal atrophy can start during perimenopause, the years leading up to menopause, or appear years after. It affects many women, with estimates suggesting between 10 and 50% experience symptoms, but many do not seek help. The main cause is the natural decline in estrogen. Other causes include surgical removal of ovaries, certain cancer treatments like chemotherapy or radiation, use of anti-estrogen medications, breastfeeding, or hormonal birth control methods. These all reduce estrogen's protective effects on vaginal tissues. Because estrogen helps keep the vaginal walls thick, elastic, and lubricated, its loss leads to thinning and dryness. This makes tissues more prone to irritation, inflammation, and discomfort. From a pelvic floor health perspective, vaginal atrophy can make sexual activity painful and increase the risk of urinary issues. This can affect overall well-being and quality of life. Managing vaginal atrophy often involves treatments like vaginal moisturizers and lubricants to restore comfort. In some cases, doctors may recommend local estrogen therapy, which can be applied directly to the vagina or taken systemically. Addressing these symptoms is important for maintaining comfort, sexual health, and urinary function during and after menopause. Women experiencing symptoms should talk with a healthcare provider to find the best treatment options for their needs.